Hi, I'm Dr. Irfan Khan, and I'm going to show you today the proper way to lubricate a high-speed handpiece. High-speed handpieces run at about 400,000 RPM, which is stupidly fast. Your car probably redlines around 5,000 or 6,000 RPM, so now go ahead and multiply that by about 80, and that's how fast one of these things runs. So you change your oil regularly in your car, you got to change the oil on a handpiece as well, because it goes through a lot of stress, and if you don't maintain it properly, we end up with excessive amounts of repair bills, okay? What we need is high functioning handpieces so we can do our dentistry efficiently, and our patient care is a lot better that way. If we don't do this correctly, we can't prep crowns, we can't prep fillings quite as easily, and that affects our patient care. So we'll make sure that our handpieces are in good working order, okay? Handpiece maintenance requires two items, a cleaner and a lubricant. The cleaner, like it sounds, it cleans the handpiece. So what you want to do is take your cleaner and insert it into the handpiece and just give it a quick little spray. That's literally it. That's all you got to do. What you then want to do is connect your high speed and actually run it for about 10 seconds or so with that cleaner. And I'm running this handpiece with that cleaner. I'm running it and spraying it in some gauze, so anything that comes out of the handpiece catches in this gauze and doesn't go into the air. There we go. After the cleaner, you need to actually add some lubricant. So we cleaned off the handpiece. That actually cleaned out all the old lubricant, so we now need to put new lubricant in there. So we actually make it worse if we just run it with the cleaner. So we want to put this lubricant in here as well. So we're going to take our handpiece, we're going to take our lubricant, and again, it's just going to be a quick little spray for just a split second. Ready? That was it. Now we attach our high speed, and we're going to run this again. And again, make sure you have that gauze in front of you there, because it's going to get everywhere. There we go. Go ahead and wipe off your handpiece then. Use some rub alcohol. You do not want to put a handpiece in ultrasonic ever. Handpieces will get destroyed in an ultrasonic, so you want to wipe this off with some rub alcohol. It's going to go through the autoclave and it's going to get sterilized, but you don't need to put this in the ultrasonic. That's not going to do you any good. It's just going to damage your handpieces. You'll notice one thing. When I ran my handpiece, I had a burr attached to it. You must always run a handpiece with some sort of burr attached. Never run a handpiece empty without a burr. It's going to throw off the balance of the head. It's going to damage the turbine. You can use an old burr. It doesn't have to come out of burr block. In fact, go ahead and use an old burr. But just go ahead and insert an old burr. Doesn't matter what type of burr it is. Just it needs something to hold on to as it spins so it doesn't throw itself out of balance. Okay? Follow those steps every single time you run a handpiece through sterilization, and these things are going to last a lot longer and the patient care is going to be a lot better. Okay? Thank you.